Hello everyone, good afternoon. So this is Meenakshi, our medical coding trainer. So today we are going to have the medical coding workshop. So here we are going to discuss what is medical coding and what are the career opportunities, what are the things we are going to study, how the code structure will be. So everything we are going to discuss here. So everyone, please be on mute while on the session. And next thing I want to tell you, if you want to interact in the session, you can use the chat section. And otherwise, if you want to speak, you can raise your hand and you can unmute yourself and you can talk to your trainer. Okay. So these are the things, and we'll be starting soon. Just give me a minute so that I will be sharing my another slide. I hope my screen is visible to everyone. So you can put a thumbs up, everyone, if my screen is visible and my voice is audible properly. Yes, everyone. I need response. I feel everybody is active. Please respond. Everybody can put a thumbs up. Okay. So whenever you want to react, you can use the emoticon section. You can use your chat section to interact in the session. Everyone, please go on mute. Everyone, please go on mute. Everybody has to be on mute. Okay. So here we are going to discuss about the world of healthcare or the global healthcare system. So the very first thing we are going to discuss what is medical coding. Okay, what is medical coding? Medical coding is little bit like a translation procedure. Medical coding is little bit like a translation procedure or transformation procedure. So what are the things we are going to translate here? All the medical services, equipment, diagnostic test, medical services, procedures, everything has to be converted into a alphanumeric codes. These are the universal alphanumeric codes. Why alphanumeric codes? The codes can be of purely numbers or the codes can be of a alphabet plus numbers. Okay. This is what known as medical coding. So this is nothing but it is a like a translation procedure. So the coders take medical report from the physician. Generally, the reports from where they will be taking from the physician or any healthcare services center or any facility or any hospitals. So what are the reports consist of? All the diagnosis, disease, all the prescription regarding what are the procedures has been done. Everything will be mentioned in the patient report. So everything has to be converted into a set of codes. And this codes, why we need this code? And this codes is essential for the medical claim purpose. So I'll discuss regarding this claim purpose. So before that, I hope it has been clear to everyone what is medical code. Okay, if you have any questions, you can ask me. So no need to wait that I will be asking you whether it has been clear or whether you are having any doubt. Whenever you feel like in the session you need to put a question, you can text me or you can directly unmute yourself and you can ask me the question. Okay. Kindly be comfortable during the session. Don't hesitate to ask any of the question. Then the second thing is, what is the need of medical coding? What is the need of medical coding? These medical codes are responsible for developing original alphanumeric codes. So I have told how the code structure will be purely numbers or alphabet plus numbers. So by using these codes, the patient insurance data will be created. So why insurance data has to be created? Because because here we are talking about the global healthcare system. So mostly you will be working on USA healthcare system. So whenever in USA, a patient is visiting to the hospital after receiving the services, everything, they won't be paying in cash. So how they will be paying all the expenditure? In terms of insurance. So in India also we are using insurance, but the coding process is not that much effective right now. Because only big hospitals, they are only using this coding process. But apart from that, most in 90% of the cases, more than 75% of the cases, you will be getting the US projects only. So by using this, first thing we know what is medical coding, and we should understand why we need the coding. Why? What is the benefit out of this coding? So mostly the patient insurance data will be created by using this codes. Healthcare insurance claim submission is handled through the medical billing. Okay, somebody raised the hand. What question you have? Somebody raised the hand. Any question, guys? Okay. If there is no question, I will be moving ahead. So by using these codes, they will create the what? Insurance data. So this insurance data will be submitted to the insurance company through the medical billing. So medical coding and medical billing, both are different. Okay, so mostly people will be getting confused whether it is same or different or what. Now, next thing we are going to talk about the benefit of coding. The benefit, mostly a coder will be working on the reimbursement process. Mostly the coders will be working on the reimbursement process. Apart from that, resource utilization, clinical care, research, education, test results. So in every sectors, this will be helpful. And then now the question is, what are the types of the medical coding? So basically, you will be studying 3 types of medical coding. These are the 3 types of book. You can call it as a books. You can call it as a manuals. So there are 3 different types of medical coding. And what is that? ICD, CPT, and HEPICS. So ICD, this is the very first book you will be studying. That is the full form is International Classification of Diseases. CPT stands for Current Procedural Terminology. You can call it as a SCPCS or you can call it as a in short HEPICS. Okay, SCPCS or in short you can call it as a HEPICS. So this stands for Healthcare Common Procedure Coding System. So these are the 3 different types of coding and these are the 3 different types of the book. If I will be talking about the book, apart from these 3 books, one more minor book you will be studying, that is the Language of Medicine. What is that? language of medicine. So why we want to study that? Because first you have to complete the language of medicine. First you have to start with medical terminology. You have to learn, you have to be very proficient in medical terminology and how to derive the meaning of a medical term. How? Because there are a lot of words. How to understand those things? Because if you understand the basic procedure to understand the terminology, then every terminology will be very, very easy for you. First, you are going to learn during the training session the medical terminology. Then human anatomy and physiology should be very, very clear. After that, we can dive into ICD, CPT, and HEPICS. And sometimes we do teach human anatomy and physiology along with the CPT book. So first we can cover your terminology. Then along with each chapter, human anatomy, physiology, along with the coding process. Then we can dive into the HEPICS. Then finally we can go for ICD. Okay. Now, first book we will discuss what is ICD. As the name indicates, the International Classification of Diseases, all the disease, injury, diagnosis codes will be available in this ICD book. So for example, suppose you are looking for a code like fever, asthma, diabetes, fracture, HIV, then your COVID, then your any kind of disease, whatever codes you want to fetch, those codes will be available in ICD book. So at the end of the session, I will show you a few examples of the code. So you have to wait for that. Okay. So just now we are going with the theoretical part. Then I will show you few of the code example as well. You have to wait for that. So this ICD book has been published by WHO. You can see ICD book, they will mention ICD 10 cm. 10 cm means this is the 10th clinical modification. This is the 10th clinical modification. Almost you will be having 22 chapters here. In ICD book, you will be having 22 numbers of chapter. So these are ICD is the most easiest coding. ICD is the most, if you can identify the disease, the diagnosis in a medical history, then easily you can code it. Okay. Then the next book is CPT. CPT stands for Current Procedural Terminology. So as the name indicates procedural, all the procedures codes will be available in this book. Who is going to perform these procedures? These procedures will be done by any physician, any healthcare professional, any non-physician, that means some technician, some hospital, outpatient facilities, some tester by the laboratories. Okay. Some test procedure codes will be available in this book. And this book has been published by AMA, American Medical Association. AMA. So it is sure this book is been published in the year of 1966. Okay, when the book has been published in 1966. That means from 1966, the medical coding is been working out. Okay. Next is what kind of codes you will be getting. So procedure, that is fine, but what kind of codes you will be getting? For example, appendectomy, CABG surgery, any biopsy, any wound exploration, removal of the stomach, removal of the gallbladder, then any heart transplant, lung transplant. So these are what? These are all procedure codes. So those procedure codes will be available in CPT. So CPT in detail at the end of the session, I'll explain. So what are the chapter, what are the things you are going to study? Mostly CPT is been divided into 3 categories. Only first category is very, very important. And the first category is again been divided into 6 sections. This 6 section is very, very important for you. Okay. So till now, everybody is clear on this. What is ICD and what is CPICS? What are the types of medical coding? And what is medical coding? Till now, everything fine, everyone? Any question from your end? Okay. I don't see any question, so I'm moving ahead. So the last book is the HIPICS book. Which one? HIPICS. HIPICS stands for Healthcare Common Procedure Coding System. So in this book, what kind of codes will be available? All the procedure codes which is not available in CPT and few additional procedures. It is not like that every procedure which is not available in CPT, you can get it in HIPEX. Not like that. Few procedure codes you will be getting, and some supplies, goods, services, most importantly, equipment codes will be available in the HIPEX book. So for example, you will be looking for a code for ambulance services, wheelchair, walker, weighing machine, oxygen cylinder, syringes, any artificial prosthesis, any lens you are looking for. All these types of codes will be available in the HIPEX book. I hope 3 types of coding is been clear to everyone. ICD, CPT, HIPEX. Okay. So these 3 books will be given you as a hard copy. Apart from that, you will be getting the soft copy. Okay. And the second thing is applications. Application in the sense, mostly you will be working on the reimbursement. A medical coder will be working for the reimbursement process. Then all the data will be used for the statistical analysis, any decision support system, any surveillance of the epidemic or pandemic outbreaks, or any evaluation process, any internal and external quality management. So these are all additional application apart from the reimbursement process. But mostly a coder will be working on the reimbursement process. So how the medical coding process flow will be? Process flow. So process flow in the sense how the work will be going on. So suppose you have joined so-and-so company, you will be given the patient data. For example, per day, they are giving you some 10, 20, 30 reports. So this is based on how many pages of report. Suppose the report consists of 100 pages. So they may give you some 10 reports. Okay. So this 100 pages will be converted into 5 to 6 codes based on how many diseases has been given, how many procedures has been done. So those data will be given to a coder. So first work is you have to analyze all the paperwork. It is proper or any data has been missed. Everything is fine. You have to verify that one. You have to retrieve all the information from the record. You have to convert it into the codes. Suppose you have converted, your accuracy must be more than 90-95%. Okay. So you have coded, that doesn't mean they will accept. There will be a pre-coding check. They will validate all the data, whatever you have coded. There will be a review of the data. There will be a review of the entire procedure codes and ICD codes. There will be audit. There will be QA team who will be verifying all the work that been done by you. Okay. Finally, they will submit it to the billing department. Okay. So these are the step-by-step workflow of a coder. Then few details I want to add you regarding billing. So what is billing? The process of creating medical claim to submit to insurance company in order to get the reimbursement for the medical services provided by providers and provider group is known as a medical billing. So what this biller will be doing? They will submit, they will create the claim process. They'll submit all the data to the so they will submit all the data to the insurance company. Okay, so this is their major job role. And very importantly, this medical biller plays a very important role, and as well as coders, not only the billers, as well as coders, they play a very, very important role in the revenue generation of any country. So the country's revenue almost depends on the medical billers and coders. So this is a great thing. I wish. Okay. So here we are not discussing the billing parts here. Next process, I will be moving for the roles of the medical coder. I have already explained how the workflow will be. Apart from that, you have to investigate all the data that has been given to you. You have to see any paper gap has been there or not. Everything you have to check. And a coder has to be a subject matter expert. So it is not like that from the day one you will be expert. After 6 months, after 1 year, after 2-3 years, you should be a subject matter expert, and you should be a good resource for the other coding professionals. Okay, you should be a good resource for the other coding professionals. And all the disease diagnosis, procedure, treatments, everything has to be reviewed and confirmed by a coder. Yes, everything is fine. So that capabilities a coders has to have. So I have told you what are the books you have to study: ICD, CPT, HIPICS, then language of medicine. Yes, that is fine. Okay. But apart from this all book knowledge, what are the skills a coder should have? Skills in the sense, all the administrative skill, reporting, organization, record keeping, Microsoft Office, you should know. Professionalism should be there, confidence, planning, verbal communication. So this all soft skill kind of things has to be there within you. You should know how to use the computer, how to be confident, how to plan the work. You should be able to communicate with your teammates. Okay. So these are nothing, some big skills. These are the very simple skills that you can learn throughout your training process. Otherwise, you can develop by yourself as well. Otherwise, you can go for any soft skills training if you are lagging in verbal communication. Okay, something you are lagging behind, you can train yourself. No issues in that. Then what is the qualification of a medical coder has to be? Okay, so basically, if you see the qualification, a person has to be complete their intermediate +2 level work, +2 level qualification has to have, one should. But it depends on the company, those who are recruiting. So they may ask whether your graduation, but some companies they hire you after +2 as well. Okay, there are most of the companies they are higher after +2, but basic has to be +2. Minimum you should have a degree on any life science background, any pharma, any nursing, MBBS, any clinicians, anything. Okay. Apart from that, if you doesn't belong any of the community, you are a BTech, MTech, any technical background, any BCA, then also you can come into this medical coding. There is no restriction, but you should be very much knowledgeable about the human anatomy and physiology. That only they will check as a fresher. If you are having some experience, they will ask you regarding ICD, CPT, HIPACS. Okay. If you are a very fresher, then they will ask you only if you are trained on this or not, that thing. If you are trained, then the very first thing they will ask you the human anatomy and physiology. Okay. So qualification has been clear. Any degree holders and what are the areas I have told you. If you have some medical experience, any background, if you have worked on medicines, if you have worked on any kind of laboratory or you are working as a physician, so that will be an additional quality for the qualification. They will definitely give a priority to you. Okay. Then role of medical biller. Here we are not discussing biller parts. Then career opportunities. So whenever we look for a job, what are the things we have to look? So we look so many things, so many things. So there are a lot of courses, there are a lot of opportunities. But why you want to choose medical coding? Those points I will be highlighting. Okay, what are the reasons you have to choose the medical coding? So whenever we go for a job opportunity, first thing what we look for the salary structure, right? So as a fresher, minimum of some 3.5 you will be getting as a fresher. If you are a experienced and you are a certified, then I have seen as a medical coding fresher with a minimum of 3 to 4 years of experience, they are getting 10 LPA as well. Okay, I have seen many examples. But it depends on how your interview goes. So interview is very important. Career opportunity, first thing we look for the salary. Salary in the sense, it is not like that. For example, XYZ is your salary. But it is not, you are not confined with that. If you are able to work more apart from your scheduled work, suppose 30 reports has been given per day, but you are able to solve some extra 20 reports per day. So that extra 20 reports will be added as an incentive, as a intensive. So a lot of incentives will be given to a coder. Suppose you are scheduled for to work on Monday to Friday, but you are available on Saturday, Sunday. You can work on Saturday, Sunday. You can generate some extra incentive along with your salary, right? So this is all about your salary. And in every 6 months, there will be increment. In which company you will be entering into, in every 6 months, there will be a hike in your salary. Okay. The second thing, we look for the stability. Stability, see, nowadays we cannot give 100% surety that this job is stable, because government people also losing their job, right? But still, at least 40 to 45% or 50%, I can see the stability is more in healthcare sector. As this medical coding belongs to your healthcare system, that's why the stability is more. Okay. So first thing salary, second thing stability. The third thing, you must be looking for flexibility. So what is flexibility? Flexibility in the sense, you are not confined in India. You are not confined in your state. You can go to any of the state, you can work, you can go out of India. So this is a global healthcare system you will be studying. So after training, after certification, you will be able to work in any of the company and of any of the country. Any company, any country you are desired to work, you can work. So mostly I suggest fresher just to work 1 year, 2 year in India. Those who are like aspirant to go abroad and work, for them I suggest at least work for 1 year, 2 year in India. Then if you want to move abroad, you can explore your career. Okay, because you do have a lot of time. Because as a fresher, if you just passed out, you have worked some 2 to 3 years, so because you have a lot of time in your hand, so you can explore different companies, you can explore different countries, you can explore, you do have a time. Okay. So this is the second thing, flexibility in the sense as well. Nowadays people are preferring work from home job opportunities, right? But for a pharma candidate, for a like physician, clinician, technician, laboratory technician, so they don't have the scope to sit and work. They can't sit at home, they can't work. But if you are into medical coding, definitely you need a good internet connection, a laptop facility. Then you can start working in your desired location. Either you can start working at home, you can go at any of your desired places, you can travel. Okay, that flexibility the job is. And apart from that flexibility in the sense, I can add one more point, like freelancing. Okay, nowadays freelancing is very, very popular. So if you suppose you have some good source of income, you can keep it as a freelancing as well. You can work with different multiple companies. So freelancing, it is not been so popular till now on medical coding, but slowly it will develop. I think so. Okay, slowly the freelancing also will develop. So these are the flexibility. Second, next thing I'll talk about, the rewarding experience. Rewarding experience in the sense, suppose you are working in any sector, you need a good experience, because medical coding is an everyday learning process. A lot of new procedures, okay, new terms you will be learning. You will be adding a piece of knowledge every day into your career. Whenever you will be going and working in any of the organization, you will be telling, I have worked so and so and so. They will definitely praise you, they'll definitely appreciate you. Okay, if you will be talking about your work around your community, definitely you will be the first person to be appreciated. Okay. And the second thing is demand in the sense, if you see any zone of the India, north, south, east, west, any zone, every year, every 6 months I can see, and on every 6 months the hiring process will be 500 to 1000 people. As a fresher they will be hiring. I'm not talking about the experienced people, I'm talking about the freshers. Okay, freshers, 500 to 1000 people per 6 month I see the hiring process. So why you can't be in between the 1000, in between the 500, why you cannot be? but you should be very much knowledgeable. So nothing is getting like you will be sitting and you will be getting the job. It is not it anywhere. You have to work hard. You have to have very good knowledge. You should be very much presentable. Definitely, you will crack the interview. Okay. So for that, you should be trained. You should be getting into a very good training process, very good certification process. After that, you can easily start the work. Okay. Next thing is prestigious job. So these are the things we look for. Salary, we look for flexibility, then demand, then your rewarding experience. The last thing is prestigious. So this job gives you a very good prestigious job in your experience. Okay. So in the community, you will be getting a very good prestigious position. So these are the things why you want to learn the medical code. So the next thing is a coder's work, a medical coder, where you will be placed. So everybody, you have to be present at the end of the session, because at the end of the session, I have something for you, that is your code structure. Okay, so these are all theory, so that you will be getting overall description for the medical coding. But at the end, because all I wish you have to stay at the end of the session, because I will be explaining the code structure. That is the most important part of the medical coding, so that you will feel interesting about learning. Okay. So the medical coder work, where you will be working, mostly in the hospital, doctor's office, healthcare, consulting services, educational institute, insurance agencies, law firms, government agencies, and most importantly, work from home opportunity you will be getting. So nowadays, work from home, they are instantly, they are not giving. At least 3 to 4 months, they want you to get trained in their institute. After that, you can go for. Okay, no issues. So these are the sectors where you will be working on. Then career path. So career path is very, very important, right? So suppose today you have joined as a junior medical coder. It is not like that for 1 year, 2 year, 3 year. You will be like that, the junior one. No, you can be promoted to senior coder, then your team manager, then your quality analyst, auditor, or your senior manager, director level. So there is a very good career path. Okay. So lot of things you can explore in there. So it is not the area is not confined. There is a huge opportunities. There is a huge opportunities you can uh, grab whenever you are entering into any company. The last thing is, what are the companies they hire the medical coders? What are the companies? Okay. Companies in the sense, the top 20 medical companies like your Fusion, Boss, Troop, Eldolet, Tech2, Fusion by Business, Iconic Solution, GA Technocare, Nissan, Pro Mantra, Pacific, Hinduja, Synoy, then Medfin, Access Healthcare, InfoHub. So these are the 20 renowned companies where you will be getting placed after the training process. Okay. So these are the things. So what we have studied, what is medical coding, why we need coding, what is the process flow, what are the career opportunities, what are the job opportunities, and what is the career path. So everything we have discussed. So now people, do you have anything to ask me? Any question till now? Any question you do have? Okay, please feel comfortable to raise your question, to ask me anything. Don't hesitate, anyone. Okay. So till now, whatever things we have discussed, I hope it has been clear. Okay. So next part, the very important part, I will be explaining, that is the coding part. Okay, coding part. Okay. So regarding the training process, wait, I will be sharing the screen once again. A code structure I will be teaching today, so that you feel interesting to learn the code and you can understand how easy the coding process will be. Okay. I hope my screen is visible, everyone. Please respond. You can put a thumbs up. Yes, visible. Need response, everyone. All are active, I feel so. Okay. If you people interact, if you people say yes or no, then only I feel yes, let's go and teach something. Okay. So just try to respond in this session. Okay. So the CPT, I was telling the second book, you will be learning the CPT book. So CPT book, the entire book is been divided into how many categories? 3 categories. Category 1, category 2, category 3. Okay. So category 1 is again, it's been divided into 6 sections. You can see under category, the code range will be 00100 to 99607. So this, what is this numbers? What is this number? So I have told the codes will be purely numbers or alphabet plus numbers. So you can see in category 2, there is alphabet F. In category 3, there is alphabet T. So here today we are not going to discuss regarding category 2, category 3 codes, which we are going to discuss category 1 code. Example, anesthesia section I will be explaining. Suppose you are getting trained, it is not like that the entire thing you have to remember. So you can be a coder of any one subject that you are having more interest and more comfortable. So if the category 1 is been divided into 6 sections, what are the section? E&M, that is known as evaluation and management, or this is the consulting codes. Second is the anesthesia code. Third section is the surgery section. Fourth is your radiology, then pathology, then medicine. So these are the 6 sections you are going to cover. And for every section, there will be a code range. You can see 992022 to 99499. So this is nothing but the range. What is range? Suppose 5 to 10. The E&M code section is starting from 5, ending at 10. That is the code range. The anesthesia code is starting from 10 to 20. That means it is 10 to 20, the anesthesia code section. These are nothing, the numbers is nothing but the range. So you can call it as a 99 series, 00 series, 10,000 to 69,000 series. Radiology will be a 70 to 79,000 series. Pathology will be 80 to 89,000 series. Medicine will be 90 to 90,000, 99,000 series. So these are the different series. And you are not supposed to remember any numbers, any codes, nothing. Okay. So that's why medical coding is the most easiest job. Okay. Most easiest job. Nothing you have to remember. If you are giving any sort of examination also, there will be a open book examination. Okay. There will be a open, if you are going for any kind of certification in medical coding, the books will be available with you. The hard copy of the book will be available with you. The thing is, you have to know where are the things present and what is the logic to find the code. That's it. Apart from that, no need to remember anything. So after completion of your training, you are comfortable in anesthesia chapter. You can be anesthesia coder. You can be a surgery coder. You can be a radiology, pathology, medicine coder. So any one section, but for the examination, everything you have to write, everything you have to study. But whenever you are working, you can choose your specialty. Suppose you are comfortable in E&M coding, outpatient coding, you can work on that. You are comfortable in medicine, you can be a medicine coder. Okay. So these are the things. And in category 1, there are a lot of symbols. Okay, you can see a circle, a triangle, a plus, hashtag, then a circle, star, bolting, lightning symbols. Okay. So today I'm not explaining all the symbols. I will teach you 2 symbols and code structure. Are you all interested, guys? Yes. I need response. Interested to learn the code structure along with few symbols. 2 symbols I will be teaching.
Yes.
Yes. Okay, very good. At least one response yet I receive. Please, guys, put a thumbs up if you are all interested, or you can type yes in the chat section. Type yes in the chat section, then only I will be explaining. Otherwise, I won't. Type yes. Most of the people, you can type yes in the chat section. Type yes or put a thumbs up. Okay, so I got some 3-4 response at least. Okay, fine. Okay. I hope you people are not sleepy. Okay. Okay. So be active, everyone. Be active. Listen carefully. If you are spending time, you have to learn something today. Okay. So how many symbols I have told? Two symbols. What is this? First will be semicolon. Second will be plus symbol. Okay. Before that, I will be explaining the code structure. So the first code is 00140. So this code is from the anesthesia section. And the description of the code is anesthesia for procedure on eye, semicolon, not otherwise specified. So what is semicolon? Semicolon means the words which is present before the semicolon. The words which is present before the semicolon is known as a common procedure. Is known as common procedure. And the words which is present after the semicolon is known as a descriptor. Is known as a descriptor. So this first code 00140 is known as a stand-alone code, or you can call it as a mother code. The first code will be a standalone code, or you can call it as a mother code. So the next code is 00142, 144, 145 up to 148. This set of code are known as intended codes, or you can call it as a daughter code. So the very first code will be your mother code. The rest of the code is the daughter code. But how to recognize this daughter code? Here you can see this code 140 code has been starting here. The gap you can see. But this code, there is a huge gap. That means this code belongs to the above code. You can see the difference. Here it has been starting. Below this description, the next code has been starting. So the next thing I have told you, these are the common procedure and the words after the semicolon, that is known as a descriptor. So these are all descriptors, 142, 144, 145, so on up to 148. These are all descriptor. Then what is the common procedure here? Anesthesia for procedure on eye. So the physician has given anesthesia on eye. To perform what? That will be the description part. So if the physician has given anesthesia on eye for lens surgery, to perform lens surgery, you will be coding 00142. So how you will be reading the code 00142? Anesthesia for procedure on eye, semicolon, lens surgery. This will be the description for 00142. The next code is 00144. The description will be anesthesia for procedure on eye, semicolon, corneal transplant. If the physician has given anesthesia on eye for the corneal transplant, then you will be picking the code 00144. Now who wants to read the code 00145, 147, 148? Anyone interested to read the code? Anyone? Anyone? Okay, nobody interested? Okay, fine. So 145, how I should read the code? 00145, anesthesia for procedure on eye, semicolon, vitreoretinal such. Then I will be picking the code 145. 00147, anesthesia for procedure on eye, semicolon, iridectomy. So on, you have to read 140. Anybody wants to read 148, last code at least? Aditya, Avinash, then Kiran, Manoj, okay, Tamanna. A lot of people are there. A lot of people. Nobody interested. Why so, guys? Okay. So I hope the code structure has been clear to everyone. Standalone code, intended code, semicolon has been clear. Please put a thumbs up. At least try to please put a thumbs up, guys. Yes, I got some 3-4 responses. Other people present? Yes. Okay. So thanks for the responses, everyone. I expect more responses. Okay. And now get ready to type your codes in the chat section, everyone. I will tell you how to type. Okay. So next is the code description. You can see 11730. The code description is avulsion of nail plate, partial or complete, simple, semicolon, single. So what is avulsion? Who knows the meaning of avulsion? Avulsion. Avulsion is nothing but the removal. Avulsion is nothing but the removal. So what the physician is removing? The nail plate. Either partially they are removing, either completely they are removing the nail plate. And this 730 code is for the removal of the single nail plate. So how many nails we do have? 10 plus 10, 20 nails we do have. So if the physician is removing single nail plate, then I will be coding 1173. Then we have a add-on code. Add-on code, how to recognize add-on code? There will be a plus symbol before a code. 11732. So how to read this code? As you can see the gap, this is a daughter code. So I should read the mother code till semicolon. Avulsion of nail plate, partial, complete, simple, semicolon. This code is for each additional nail plate. That means after removing the very first one, the remaining nail plates has to be coded with 11732. Is that clear till now? Any questions? Okay. Now type the code if the physician has removed 3 nail plates. Okay. Okay, let me tell you the first one. If the physician has been removing 3 partial nail plate, how you should code it? Let me type in the chat section. Okay. So you, for the very first nail, you will be coding 11730, comma. For the additional 2 nail plates, you will be coding plus 11732. 732 has to be coded 2 times. So rather than to write the code 2 times, what you will be doing? You will be putting into 2. So everyone received the code in the chat section. So for the very first nail plate, you will be coding 11730. Remaining 2 nail plates, you have to write 11732 into 2 times you have to write. Rather than to write in 2 times, you can multiply with 2. Fine, everyone? Okay. Now type the code in the chat section, everyone. If the physician has removed 7 nail plates, partial 7 nail plates, how you are going to code it? If the physician removed partial 7 nail plates, how you will be coding? Type your codes in the chat section. Yes. Yes, yes. Okay, type your answer quickly. For the very first nail, what you will be coding? I don't see any answer. Okay, one answer is received from Tamanna. Tamanna, it's wrong. I'll tell you why. I'll tell you why. I have told to code for 7 nail plates. I have told to code for 7 nail plates. Okay, I received only one. What about others? What about others? Gaurav, Dhananjay, Avinash, Nikhil, Manoj, Kiran, Subham. I need answer, everyone. Yes. I received only one answer. Okay, Nikhil. Oh, Nikhil, very good. It's correct. Very good. Others, type your codes in the chat section. Be quick. Okay, I'm waiting for next 30 seconds. Then I will wind up the session. Okay. Okay, I don't see any answer. Only Nikhil was correct. So again, I'm typing the codes for everyone so that you can see the codes. So for the very first nail plate, you will be coding 11730. That is for the very first nail. The remaining, how many nail plates we do have? 6. So this plus 11732 has to be coded 6 times. So rather than to write the code 6 times, what you will be doing? You will be writing into 6. Okay. I hope this code structure has been clear to everyone. I hope. So any doubt, any queries means you can ask me, people. If you have any doubt, any queries, you can ask me. Apart from that, I want to tell you, you can see on my screen, this is a trainer portal. So if you scroll down this left-hand side scroll bar, you will be getting chapter-wise modules. Okay. If you are enrolling as a student, you will be getting a chapter-wise module. Notes will be present here. Okay. If you scroll the right-hand side scroll bar, here the soft copy of the book will be present. This is the CPT books, HIPIX books, ICD books. So all books contents will be available. So this class recordings, suppose you have missed today's class. Okay. So here you can go to the recordings, you can watch the video lectures, or you can watch the video lectures on repeat. You will get all the modules and you will get all the soft copy of the book, all the hard copy of book at your address. Apart from that, recording of the classes, a question bank will be there, and then finally after completion of your training session, you can go for the like examination in the portal itself. So I'm waiting for next 30 seconds if I can get any question from your end. Any question, guys? Don't hesitate. If you have any question, you can raise your question. You can type your question in the chat section. Somebody is talking. If you are not talking in the class, please be on mute. If you are talking to me, then only you can unmute yourself. I can see some different languages. So if anybody missed the starting of the webinar, they can ask the recording to the respective coordinators through whom you have joined the link. You can ask the recording of the session. Okay. At the end, you can like listen to that. So thank you so much everyone for your presence, for your time. I hope this session was interesting. If you receive any feedback form after the session, kindly fill that form. Okay, kindly you have to fill that. I hope this is interesting. If this is interesting, please put a thumbs up, everyone. If the session was interesting, you have learned something today. Yes. Okay, thank you so much for your response, everyone. Have a great day. Okay, I wish you all the best. And bye, everyone. Bye. Thank you for the time. Okay. Hello, so somebody I think texted me for the certification, right? Certified coder. So this is not the certification, this is the training process. So after the completion of the training, you have to give for the certification. Okay. After the completion of the training, you have studied, you have get trained, then you have to appear the examination for the certification. So after that examination, you can call yourself as a certified coder. Is that clear? Type yes in the chat section. So this question was from J. Walshan. Jijishma Walshan. Okay. Is that clear? Type yes in the chat section. Yes, okay. Any other questions, miss? You can ask me. Any other question you do have, miss? You can ask. Okay. So bye everyone. Okay.